Welcome to a transformative journey of strength and vitality, brought to you exclusively by our dedicated channel, Peaceful Vital Health Online. With over 30 years of experience in orthopedic surgery, I have witnessed how our bodies change as we grow older. Our muscles are the engines of our mobility, but without proper care, they can slowly fade away over the years. Today, we will explore the science of maintaining your independence and preventing the silent conditions that limit our daily lives. We are focusing on two major enemies of aging: sarcopenia, which is muscle loss, and osteoporosis, the weakening of bones. These conditions often progress silently, making our bones fragile and our muscles too weak to support our skeletal structure properly. However, the good news is that we can reverse this process through targeted movements that stimulate both muscle and bone. I have selected 3 specific exercises that are scientifically proven to build the essential armor your body needs for longevity. These movements target the lower body, which is the foundation of your balance, stability, and ability to move freely every day. Many people realize too late that they have lost the ability to perform simple tasks, like rising from a chair. Strength is not just about power. It is about reaction time and the ability to catch yourself before a fall. We will master 3 key exercises today: sit to stand, side leg raise, and the neurological challenge of single leg standing. Let us begin with the first and most fundamental movement, the sit to stand exercise, a true test of independence. This exercise is often used by medical professionals to evaluate the functional age and strength of a patient's lower body. It primarily targets the quadriceps at the front of your thighs, which are critical for climbing stairs and walking safely. Simultaneously, it engages the gluteus maximus, the largest muscle in your body, providing the power needed to lift your weight. To perform this correctly, start by sitting on a sturdy chair with your feet placed firmly flat on the floor. Ensure your feet are hip-width apart, giving you a stable base of support that prevents wobbling during the movement upward. Cross your arms over your chest. This is crucial because it prevents you from using your hands to push up. Using your hands or momentum defeats the purpose of the exercise, as it takes the load off your leg muscles. Engage your core and press through your heels to stand up fully, extending your hips until you are completely upright. The upward movement should be controlled and deliberate, taking about 2 seconds to reach the full standing position from sitting. Once you are standing, pause for a brief moment to stabilize your body and ensure you have full balance control. Now, begin the descent. This is actually the most important part of the exercise for building deep muscle strength and control. Lower yourself slowly for a count of 3 seconds. Do not simply drop into the chair. Control gravity with strength. This slow lowering phase, known as eccentric contraction, creates micro tears that repair stronger, effectively combating age-related muscle loss. Watch your knees carefully. They should remain parallel and track over your toes, never collapsing inward as you sit down. Touch the chair softly. If you land with a thud, it means you let go of the muscle tension too early. Repeat this cycle. Up for 2 seconds, pause, and down for 3 seconds. This rhythm ensures maximum benefit for your muscles. For beginners, aim for 10 repetitions. If you feel tired, rest. Quality of movement is far more important than quantity. This exercise does more than build muscle. It stimulates the femur bone, increasing density where hip fractures commonly occur. Mechanical stress from the muscles pulling on the bone signals your body to deposit more calcium, strengthening the skeletal structure. Mastering this ensures you can get out of a car, off the toilet, or up from a sofa without help. If the standard chair is too difficult, place a firm cushion on the seat to raise the height slightly. You can also place your hands lightly on your thighs for sensory feedback, but try not to push with them. Remember to breathe. Exhale as you exert effort to stand up, and inhale deeply as you slowly lower yourself down. Safety is paramount. Ensure your chair is placed against a wall or is heavy enough that it will not slide. You should feel a burning sensation in your thighs. This is a positive sign that your muscles are being challenged. Consistency with this simple movement can reverse years of sedentary living and significantly reduce your risk of becoming frail. Now that we have strengthened our vertical movement, we must address a critical but often overlooked area: lateral stability. Our second key movement is the side leg raise. This exercise is your primary defense against sideways falls and hip injuries. Statistics show that most hip fractures occur from falling sideways, not forward. We need to strengthen the muscles that prevent this. This exercise targets the gluteus medius and minimus. These small muscles on the side of your hip stabilize your pelvis. Stand tall beside a chair or countertop. Rest your hand lightly on it for balance, but do not lean on it. Keep your body perfectly upright. A common mistake is leaning your torso to the opposite side to lift the leg higher. Slowly lift one leg out to the side. You only need to lift it about 30 to 45 centimeters high. Keep your toes pointing forward. If your toes rotate up towards the ceiling, you are using the wrong muscle group. Rotating the foot recruits the hip flexors instead of the glutes. We want to isolate the side hip muscles specifically. Hold the position at the top for a second. Feel the contraction on the side of your hip and buttocks. Lower your leg slowly back down. Do not let gravity pull it down. Force your muscles to control the descent. Imagine your pelvis is a bucket of water. Keep it level so water does not spill as you lift your leg. Perform 10 repetitions on one side, then turn around and repeat with the other leg to ensure balanced muscular development. This muscle is your stabilizer. When you stumble sideways, this is the muscle that fires rapidly to pull you upright. Place your hand on the side of your hip as you move. You should feel the muscle hardening under your palm. Avoid the temptation to kick high. Range of motion is less important than keeping your spine straight and hips stable. As you get stronger, try to rely less on the chair for support, eventually performing the movement with hands free. Maintain a steady breathing pattern. Holding your breath increases blood pressure, which we want to avoid during these exercises. Strong hips allow you to navigate uneven terrain, crowded places, or slippery surfaces with much greater confidence and safety. Weak hips often force the lower back to compensate, leading to pain. Strengthening here can actually alleviate back issues. By strengthening the gluteus medius, you are building a safety mechanism that protects your hips, spine, and overall mobility. We have built power and stability. Now we must train the communication between your brain and your muscles. Our final exercise is single leg standing. This is not just a muscle workout, it is a neurological training session. Balance is a complex skill. It requires your eyes, inner ear, and muscles to work together in perfect harmony. We are training proprioception, which is your body's ability to sense where it is in space without looking at it. Stand near a solid surface like a counter or sturdy table. Safety is critical, so ensure support is within reach. Lift one foot slightly off the floor. You do not need to lift it high, just enough to clear the ground. Stand on the supporting leg. You will feel your ankle and foot muscles making tiny adjustments to keep you upright. Those small twitches in your ankle are good. That is your brain and muscles communicating rapidly to maintain your balance. Aim to hold this position for 10 to 30 seconds. If you wobble, simply tap your raised foot down lightly. Keep your hand close to the support surface. You can hover your hand or touch it lightly with one finger. Fix your gaze on a stationary object at eye level. Visual focus is a key component of maintaining physical balance. Switch legs and repeat. You may notice one side is more stable than the other. This is normal but needs correction. A great habit is to practice this while brushing your teeth. It guarantees you train your balance twice every day. As you master this, try closing your eyes. This removes visual aid and forces your brain to rely solely on feeling. Only attempt the eyes closed variation if you are very confident and have a solid support surface immediately within your reach. This exercise keeps your neural pathways sharp. It trains your body to react instinctively if you trip on an obstacle. That split-second reaction to correct your balance can be the difference between a minor stumble and a serious bone fracture. These 3 exercises form a complete triad: vertical power, lateral stability, and neurological balance. Together, they are your best defense. You do not need to spend hours in a gym. Performing this routine 3 to 4 times a week is sufficient. Combine these movements with adequate protein and calcium intake to provide the raw materials your body needs to rebuild tissue. The goal is not just exercise. It is preserving your ability to enjoy life, play with grandchildren, and travel freely. I often hear patients say they are too old to start. I tell them that muscle can be built at any age. Studies show that even people in their 90s can increase muscle mass and bone density with consistent, targeted resistance training. Remember, sit to stand builds the engine of your legs, ensuring you can rise to any occasion throughout your day. Side leg raises secure your hips, protecting you from the lateral instability that causes the most dangerous types of falls. Single leg standing sharpens your nervous system, keeping your reflexes fast and your body responsive to the changing environment. Listen to your body. Some days you will feel stronger than others. The key is to show up and try. If you have friends or family who could benefit from this knowledge, please share this guide with them to help. Health is contagious. When we improve our own vitality, we inspire those around us to take better care of themselves. Do not expect overnight miracles. Physiology takes time, but in 3 months you will feel like a completely different person. Commit to this routine for 12 weeks. You will notice walking becomes easier and your fear of falling will disappear. Imagine the freedom of climbing stairs without pain, or walking on the beach without fearing the uneven sand beneath you. Always consult with your own physician before starting a new exercise program, especially if you have existing health conditions or pain. Your health is your most valuable asset. Investing time in these exercises is investing in your future freedom and happiness. It has been my privilege to share this medical knowledge with you. I hope it empowers you to live stronger. At Peaceful Vital Health, we are committed to bringing you science-backed, practical advice for a long and vibrant life. Please subscribe to our channel and click the notification bell so you never miss our upcoming guides on healthy aging. We have many more videos covering nutrition, joint health, and mental well-being, designed specifically for your unique stage of life. Thank you for watching and trusting us with your health journey. Stay strong, stay active, and we will see you soon. From all of us here at Peaceful Vital Health, we wish you a day filled with energy, balance, and peace. Stay tuned as we take a deeper look into the fascinating biology of how your muscles communicate with your bones. When muscles pull on bone, specialized cells called osteoblasts are activated. They act like construction workers, repairing and reinforcing a bridge. Regular exercise slows down the activity of osteoclasts, the cells that break down bone tissue, keeping your skeleton denser for longer. Repetition of these movements also thickens the myelin sheath around your nerves, allowing signals to travel faster from brain to muscle. This increased signal speed is what allows a trained individual to correct a slip instantly, while an untrained person might fall. Do not forget the feet. These exercises also strengthen the small intrinsic muscles in your feet, providing a solid foundation. Wearing proper footwear is essential. Choose shoes with non-slip soles and good support to prevent accidents while you are exercising. If your floor is safe and warm, practicing barefoot can actually enhance the sensory feedback your brain receives from the ground. Hydration plays a role too. Dehydrated muscles cramp easily and coordinate poorly, so drink water before and after your routine. Remember that muscle is built while you sleep. Ensure you are getting quality rest to allow your body to repair itself. The psychological benefit is immense. Knowing you are physically capable reduces anxiety and encourages you to participate more in social life. Whether it is dancing, gardening, or traveling, your physical strength is the key that unlocks the door to these enjoyments. Carry this awareness of posture with you throughout the day. Stand tall, keep your shoulders back, and engage your core gently. You can integrate these exercises into your day. Do a few sit-to-stands during television commercials to break up sitting time. Utilize idle time in the kitchen. While waiting for the kettle to boil, perform a set of side leg raises. Keep a simple journal of your progress. Seeing the numbers increase over weeks is a powerful motivator to keep going. If you find it hard to stay motivated, find an exercise partner. Accountability makes the journey more fun and sustainable. Learn to distinguish between muscle fatigue, which is good, and sharp joint pain, which is a sign to stop immediately. Vitamin D is crucial for bone health as it helps absorb calcium. Get some sunlight or consult your doctor about supplements. As we age, our bodies process protein less efficiently. Ensure you include a high-quality protein source with every single meal. Minimize habits that damage bone density, such as smoking and excessive alcohol consumption, to give your body the best chance. I have seen patients who could barely walk transform their lives. It requires patience, but the human body is incredibly resilient. Ask your doctor about a bone density scan. Knowing your starting point helps you measure the effectiveness of your efforts. Let us review one last time. Sit to stand for power. Keep your chest up, weight in heels, and control the descent. Side leg raise for stability. Keep your torso still, lift from the hip, and do not let your toes rotate upward. Single leg standing for balance. Focus your eyes, stay near support, and challenge your brain to control your body's position. The best time to start was 10 years ago. The second best time is today. Do not wait for the perfect moment. Your strength is a gift to your family. It relieves them of worry and allows you to be an active participant. Thank you for spending this time with me. Education is the first step, but action is what creates real change. Knowledge is power, but action is health. Take what you have learned today and put it into practice immediately. May you find strength in your steps and peace in your heart as you continue on your path to wellness. This has been a presentation by Peaceful Vital Health. We are dedicated to being your partner in the journey of aging. If you found value in this video, a subscription helps us create more free content for people around the world. Take care of your body, cherish your health, and remember that you are stronger than you think. Goodbye for now. Thank you for watching Peaceful Vital Health. We look forward to seeing you in our next video. Have a wonderful day.